Prolonged sitting, okay, people that sit up all day. Core flexibility, okay, again, tight hip flexors, tight lower back, tight hamstrings, tight calves, tight ankles, okay. A sedentary lifestyle, which we know, the more people are inactive, the more likely they are to suffer from some type of pain, okay. Excessive bending and twisting, okay. And I see this a lot too, a lot of the golfers when they get out of their cars, you know, again, these are not really conditioned people, so when they get out of their cars, they go to their trunk, they pull out a big bag, okay, and they do this every single day, all right. A lot of that for lifting technique. Okay, this can go in and outside the gym, okay? And it's just as bad as inside the gym as it is outside the gym, okay? Excessive vibration for people that, if you deal with people that drive a lot for a living, okay? The excessive vibration of being in a car, that can cause a lot of discomfort. Past injuries, altered joint function, okay, which we're going to talk about again. Muscular imbalances, again, injuries can also cause muscular imbalances along with all these at the top. And then fatigued spine stabilizers. Okay, and what that means is basically the more deconditioned someone is, then when they try to do some type of core work, their core basically fatigues and it can't hold the structure anymore of the body, the extrinsic muscle groups, okay? So establishing spine stability during fatigue, which we're going to do a drill today. Bracing ability is lost during lifts due to active or passive fatigue. Okay, outside the gym, it's gravity versus the posture. Okay, so I'm sure a lot of you that sit all day, if you by 1 o'clock, 2 o'clock in the afternoon, you start feeling what you call creep, and you start feeling that tightness, and you start kind of moving a little bit of that and stuff like that. That's basically your posture and passive fatigue occurring, where muscles are beginning to ache because they're just simply getting tired. They're not conditioned to endure such a long flexed position, statically flexed position. And then in the gym, you have session volume versus recovery. And this is really for people that lift for a long period of time, like in one session. And they basically, their form starts to deteriorate as the session goes on, or the more weight that they try to lift, what will happen there is the form again will just falter because it just becomes deconditioned or it's not trained endurance-wise. Okay, so how do we train for this? We're going to mimic fatigue followed by core activation. We're going to do that in the practical portion. Okay, round up. Okay, so remember, we want to activate the core or be able to stabilize the spine even under fatigue. So we have to train our clients to be able to withstand fatigue setting in and keep the house intact, basically. Okay, so think of it as like a tornado. Okay, your house, your body, or the core. Tornado is the training, the lifting of the weights, things like that. And when that tornado comes through, fatigue sets in. So when the fatigue sets in, the house blows up into shreds. So basically we want to build a strong foundation. So we want to counteract fatigue from setting in. And the way we do that is we mimic fatigue and then we follow that up with a core stabilization exercise. So I'm going to use you two guys, jump up on the treadmills. And we're going to do just a very quick, fast run. As fast as you can, so we get a little bit of hyperventilation going on, breathing a little heavy, and things like that.
It's just so you pass out. Yeah.
We're all CPR certified, so it's okay. And we're gonna go for about a minute and a half run.
We're going ready to go run right now?
Yeah, we've all pretty warmed up.
Pretty much up. Let's let it off.
Just about a minute and a half run, and then we're going to go into a core stabilization exercise. I want you to keep note. You're not going to do this with all your clients. You're going to do this mostly with your conditioned clients, okay? When you have a client who's been working out with you for a few months or what have you, and they're making great gains, but you still see some lag in their form, you want to teach them or train them how to keep that form intact when they start to fatigue. I need you guys to run a little bit fast. Okay, so this is a high intensity type of cardio session. I wouldn't do this as a 30-minute cardio session. That would be more. So we're going to do a high intensity type of session. Okay, so go ahead and slow down. Go ahead and slow down and then stop. And then immediately have them come off if you guys don't want to make some room. We're going to immediately get off and then we're going to go into a shoulder core stand or a side plank position. And we're going to hold that. Go ahead, guys. And begin. And then what you want to do is you want to make sure that the form stays intact. Now, what's happening right now? Nope, Sean, we're not going to do it the easy way, we're going to do it the hard way. There you go. Now, what we're going to do here, he's ventilating, so the diaphragm and the lungs are working overtime. And at the same time, we're trying to maintain this core stabilization. Okay, so this is truly conditioning the core. All right, so we want to try to hold that for time, usually for about 1 minute on the side plank, which is actually very, very good. Okay, the norms are usually a plank 2-minute hold, side plank 1 minute hold. Oh, yeah, 1 minute hold. Okay, very good, guys. Relax. Okay, how was that? Give me some feedback.
Good.
Okay, it was pretty hard, right? Because you're breathing so hard,
Yeah.
and then I have you go into this core exercise. Okay,
Think about breathing, make sure you have not
exactly, yeah. So the breathing actually interferes with the core stabilization and the spinal stabilization. So that's what we want to train our clients to do, is that they are able to go through this fatigue setting and be able to hold form better whenever they're lifting and things like that.